Overview. What is an abdominal mass? An abdominal mass is a growth or tumor in your belly. Lots of things can cause them, including cysts, cancers, and other diseases. Some abdominal masses are harmless, but others can be life-threatening. Depending on the underlying condition, you might have one mass or several. A mass in your abdomen doesn't necessarily mean you have cancer. Many abdominal masses are benign, non-cancerous. But if you have one, you should still get it checked out. Abdominal masses can form anywhere in your abdomen, including the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant, middle of your belly, just below your ribcage, epigastric region, area around your belly button, periumbilical region, part of the belly wall itself, subcutaneous and muscle wall. If you feel a pulsating lump in your belly along with severe pain, seek medical care right away. It could mean you have an aortic aneurysm, a bulging area in your aorta. If this bulging area bursts, it can cause internal bleeding and other life-threatening symptoms. Symptoms and causes. What are the symptoms of an abdominal mass? Whether you experience symptoms depends on several factors, including the underlying condition and the type, size, and location of the mass. In some cases, healthcare providers detect these growths during routine checkups before you ever develop symptoms. If you develop abdominal mass symptoms, they may include abdominal pain, blood in your pee, hematuria, constipation, diarrhea, feeling a fullness in your belly, fever, nausea and vomiting, rectal bleeding, swelling or lump in the affected area, unintentional weight changes, losing or gaining weight for no apparent reason. What causes abdominal masses? A range of health conditions can cause abdominal masses. Cysts. Cysts are sacs filled with fluid or infection. You can get them almost anywhere on your body. These types of cysts may cause abdominal masses. Ovarian cysts, pancreatic cysts, pancreatic pseudocyst, peritoneal inclusion. Your peritoneum is the membrane that lines your abdominal cavity. Seroma, fluid collection after surgery. Cancer. These types of cancer could cause abdominal masses. Colon cancer, endometrial cancer, gallbladder cancer, kidney cancer, liver cancer, neuroblastoma, stomach cancer, uterine sarcoma, gastrointestinal stromal tumor, other diseases. Many other health conditions can cause abdominal masses. Some of these diseases and disorders include abdominal aortic aneurysm, Crohn's disease, diverticulitis, enlarged liver, hepatomegaly, enlarged spleen, gallbladder inflammation, cholecystitis, hydronephrosis, uterine fibroids. What are the complications of abdominal masses? An abdominal mass can press on other organs in your belly. This could lead to general complications like pain, swelling, bloating, loss of appetite. Other complications vary depending on the underlying condition. For example, people with masses due to Crohn's disease may develop intestinal blockages. People with abdominal masses due to uterine fibroids might have abnormal uterine bleeding. Diagnosis and tests. How are abdominal masses diagnosed? A healthcare provider will start with a physical examination. They'll review your health history and ask about your symptoms. Next, they'll ask you to lie down on an exam table while they gently press on different areas on your belly. This can help them locate the abdominal mass and determine if any of your organs feel swollen or tender to touch. If your provider can feel the growth during the examination, it's a palpable abdominal mass. Palpable means able to be touched or felt. Quote closing parenthesis dot. Tests used to diagnose abdominal masses. Once your provider completes your exam, they'll probably need to run some additional tests. These tests may include an angiogram to check your blood vessels and find blockages in your arteries, blood tests to check hormone levels or look for signs of infection inside your body, colonoscopy or upper endoscopy to look at your digestive system from the inside, imaging tests like abdominal X-rays, CT, computed tomography, scans or MRI, magnetic resonance imaging, transvaginal ultrasound to check for masses in people with uterine conditions, urinalysis, pee tests, to find any abnormalities in your urinary system. Management and treatment. How do you treat abdominal masses? Treatment depends on what's causing your abdominal mass. Your healthcare provider will focus on addressing the underlying condition. Treatment for an abdominal mass could include medications to treat any underlying conditions, surgery to remove the abdominal mass, chemotherapy or radiation therapy to shrink the mass, usually before surgical removal, surveillance, watchful waiting, to see if it changes over time. Find a primary care provider. Schedule an appointment. Outlook, prognosis. What's the outlook for people with abdominal masses? Your overall outlook depends on what's causing the mass. Some abdominal growths, like cysts, may not need treatment at all. Other abdominal masses, like cancerous ones, require specialized treatment that may involve surgery, chemotherapy, or radiation therapy. With such a wide range of possibilities, lean on your healthcare provider to investigate. They can design a personalized treatment plan for your specific situation. Prevention. Can abdominal masses be prevented? You can't always prevent abdominal masses because it's not always possible to know when you're at risk. Sometimes, things happen without a known cause or reason. The best thing you can do is treat and manage any underlying conditions, and see your provider for regular checkups. Living with. When should I see my healthcare provider? Schedule a visit with a provider if you notice signs or symptoms of an abdominal mass, including pain in your belly or sudden changes in your weight or bowel habits. If something feels off, let a provider know. They can run tests to see what's causing your symptoms. When should I go to the ER? Call 911 or head to your nearest emergency room if you have severe abdominal pain. A lump in your belly that feels like it has a heartbeat. This is an emergency condition that needs immediate medical attention. These symptoms could indicate an aortic aneurysm, a bulging area in your aorta. If this bulge bursts, it could be life-threatening. What questions should I ask my doctor? If you have an abdominal mass, here are some questions you may want to ask your healthcare provider. What kind of abdominal mass do I have? Is it cancerous or non-cancerous? What kind of treatment do I need? Will I need surgery? If so, how soon? Do I need chemotherapy or radiation therapy to shrink the mass? How long will my treatment last? What if I don't do anything? What's the overall outlook for my diagnosis? Hearing, mass, and diagnosis in the same sentence can send you into an emotional tailspin. What kind of mass? Do I have cancer? Is it life-threatening? If these are the questions running through your mind, you're not alone. Your healthcare provider is here to find out why you're having symptoms and what kind of mass you have, as well as what kind of treatment can help. Primary care providers offer lifelong medical care. From sinus infections and high blood pressure to preventive screening, we're here for you. Find a primary care provider. Schedule an appointment.